Hi, it's Dr. Hizon here to talk about back pain, both cervical, thoracic, and lumbar spine pain. Please refer to your particular doctor. This is a general course not intended to be medical treatment, and your particular situation may vary. So the symptoms of low back are very common. Most back injuries include sprains and strains, herniated disc, and even fractured vertebra. The lumbar spine, which is the low back, is often the site of back pain. The area is susceptible because of the flexibility and the amount of body weight on a regular basis that the back goes through, and you yourself may have even had back pain. The physical exam, ROM, means range of motion, can be tender with forward flexion, which is forward bending, as in this picture, or extension, rotation, and postural changes. We do a neurologic exam, which includes both motor and sensory. We might do reflex hammers, and then special straight leg tests do special tests such as straight leg raise, the Patrick Fabre, femoral, neural traction, Trendelenburg, and some other ones. So the workup and the testing is usually with history, physical, and then imaging such as x-rays, MRI, and even ultrasound. Treatment is initially to avoid aggravating activities and inflammatory medications. You do home exercise or formal physical therapy, and then ice for 15 minutes several times a day. The plan usually is non-pharmacologic, such as heat, massage, acupuncture, spinal manipulation. You might use medications, anti-inflammatories, muscle relaxants, straight pain medicines. Could do injections such as cortisone or other types of injections. And then there's other therapies such as physical therapy, which is a TENS unit, which is electrical muscle stimulation, traction, and formal physical therapy. Usually what we educate the patients on is avoid activities that irritate, especially prolonged sitting, lifting heavy objects, bending forward, twisting, and other sorts of things like that. So how do you document if you're an informatician for the patient with spine pain? First, you want to know the chief complaint, which is pain in which part of the back for how long a time. And then with the history of the present illness template, generally it's a male that is 22 years old without a history of other problems but could have diabetes or something, presents for pain to the cervical region of the back for 14 days. The date of onset was 2 weeks ago. It was a sudden onset after twisting. The severity, we like to do the pain scale, 0 out of 10, 10 being the worst pain you've had in your life, so maybe it's 2 out of 10 at rest, with 10 out of 10 with movement. We also can do things such as, is it intermittent or constant? What's the quality? What makes it worse? So that's a provocation. What makes it better? Associated symptoms, especially with sleep. Is there tingling or numbing in the arms or legs? Popping, clicking, previous back pain, previous surgery of the affected joints, previous treatment so far. Have they had anything like medications, physical therapy, injections? Have they had a previous workup such as imaging, x-rays, MRI? Have they seen any specialists or other providers such as orthopedic surgeons, chiropractors, massage therapists, acupuncturists, physical therapy? And you can possibly do these as a plus or minus, or you could do free texting. And then on the past family, medical, social history, are they a tobacco user? How's their exercise, nutrition, sleep? On review of systems, which is basically our checklist to make sure we don't miss anything. And constitutional symptoms, usually is there any sort of weight loss. The other thing that we do that didn't get brought up here is red flags, and that's something that we can talk about. But there is something to look up called red flags, especially for low back pain. And that's like, be very careful if someone has a history of, say, cancers, or if they're older, or if they've had previous other problems. Those are some red flags that make you think that it might be something more serious and some systemic disease. And then on the physical exam, we do a general evaluation. How's their appearance? We'll look at heart, lung, abdomen. But then when you get to the back, you want to know, how is their posture? They have forward poor posture or good posture? How's their gait? Is there any deformity, any swelling? Is there any alignment? Is there any redness or bruising? How is it to palpitation? So TTP is tender to palpation on 0 out of 10. And where is it tender? Is it on the bones, the ligaments, the tendons? Do they have any problems with the range of motion? ARM is active range of motion, passive range of motion, or resisted range of motion. How's their neurovascular? Their reflexes, motor sensation, distal pulses, capillary refill for neurovascular. And then special tests, such as the cross straight leg raise, femoral nerve traction, slump, Ober, Thompson, straight leg raise. Do they have hypertonicity? Do they have any problems with sitting or standing? And then how is the joint above and below? So how are their hips? How are other things that are nearby to them? So then once you come up with your evaluation, you come up with your assessment and your medical decision making. In the medical decision making, you give a statement based on, is this a simple or complicated case? Does it require straightforward or complex decision making? So this is a chance to give you a reason and a rationale for your treatment. The diagnosis, these are some of the ICD-10 codes. So M54.5 is just straight low back pain. Then you could have muscle spasm. And then there's the S code, so those are M codes. S codes are unspecified muscle. You can have specific injuries. And then again, with orthopedic type injuries, you want to give the activity you're doing, say basketball, as well as the place of occurrence that it could happen at. On the plan of treatment, you can do home exercises, formal physical therapy, anti-inflammatories. You can do ultrasound, MRI, injections, ultrasound types of treatment. So in terms of pearls and pitfalls, be very, very careful that you get the correct affected side, left versus right, and it's the patient's left to right. And always compare laterality. Be sure to document all previous treatments, past medical history of injuries, surgeries, have they had motor vehicle, accidents or crashes, slips or falls. Learn the various questions to ask on the physical exam, and again, the red flags to watch out for. Please ask your doctor if you have questions about the examination of the back. And in primary care, ask about the quality measures, which are preventative type measurements, especially things such as colonoscopies and mammograms. And takeaway points are that injuries to the back are very, very common. The mechanism of injury can be non-specific or can have a specific traumatic event. It's important for you to study hard to learn the various questions to ask on the physical exam, as well as the special tests that are used to determine the exact etiology of the back pain. And as always, I want to thank you because while doctors save lives, informaticians and scribes save doctors. Thank you.